by the South Dakota Department of Health. I would quickly like to remind you to mute all your lines. Thank you. Today we are going to be bringing you the latest COVID-19 related numbers and distribution efforts updates across South Dakota. Joining us today is Secretary of Health Kim Molson-Risden, State Epidemiologist Dr. Josh Clayton, and South Dakota Department of Health Communication Director Daniel Bucciarelli. At this time, I will turn it over to Daniel Bucciarelli, our Communications Director, for the most up-to-date data on COVID-19.
Good morning, everyone. Thank you for joining today's conference call. Happy 2021. South Dakota Department of Health has thrived on bringing South Dakotans and members of the media the most up-to-date health information as it becomes available. In 2021, this will be no different. Empowering our citizens with accurate and updated information better allows them to make decisions for themselves, their families, and businesses. To that end, here's the latest statewide COVID-19 information as of this morning. New confirmed cases, 419. New probable cases, 188. Active infections, 6,387. Recovered cases, 93,778. Currently hospitalized, 264. Total tests performed statewide, 783,608, out of which 379,041 are unique persons, 101,684 positive cases, 277,357 negative persons. We're currently reporting the RT-PCR positive rates since that measure is being used by CDC as well as CMS for nursing home long-term care facility reopening plans. That last 7-day number as of this morning is 15.8%. Additionally, 23,879 vaccines have been administered, and South Dakota is leading the nation in that effort. All this data can be found on COVID-19 dashboard, which can be found at doh.sd.gov. Just as a reminder, data reported on the dashboard is considered provisional and is updated as it becomes available. I will now turn it over to our state epidemiologist, Dr. Joshua Clayton.
All right. Thank you, Daniel, and thank you for the numbers update. Just a reminder for folks, you can go out and visit our dashboard, which includes all the information that Daniel just mentioned, as well as additional updates that we have. One of those updates I'd like to point out is that we do have on the vaccine tab the number of doses that have been administered by week. So you can go out there and you can see what that cumulative number looks like. For COVID-19 testing, we have seen testing volumes decrease slightly, which is mirroring the decreases of cases that we have seen in the state of South Dakota. Just a reminder that we are recommending, that all close contacts to persons with COVID-19 infection are recommended to get tested. And so that may be with your individual healthcare provider, or it can be by visiting the Department of Health website at covid.sd.gov and getting a saliva-based testing. We will be also adding some additional information on the number of deaths that individuals died with COVID-19 or due to COVID-19. That's going to be an update to our vital records data that we provided middle part of last month, and so we're looking to get that information on the website here very soon. And just keep in mind that that information will include those individuals who died, whose death was caused by COVID-19, as well as all-cause mortality information. And that data is provisional as well. It does take us some time to complete that data set, and we'll have more information as additional becomes available. Just wanted to provide some updates on the UK strain that has been out in the media recently. So the UK strain has been identified now in 5 states. That includes Colorado, California, Florida, New York, and Georgia. The UK strain has not been identified in South Dakota. South Dakota does continue to partner with CDC and communicates with other states to quickly identify any mutations in SARS-CoV-2 that cause COVID-19. At this time, we're not concerned about it affecting vaccine effectiveness. The concern really is around that UK strain that it is able to be transmitted more quickly or more effectively to individuals, which could put further strain on the U.S. healthcare system. So we continue to monitor the situation, and we'll provide updates as needed. We also want to mention just the importance of continued mitigation throughout winter. We recognize that COVID-19 is very high in many other states, and that the CDC and Department of Health continues to recommend that individuals take precautions such as cough and hand hygiene, physical distancing, avoiding crowds, and wearing a mask when that distancing is not possible. Just a quick note around influenza, that we do continue to monitor the situation and our influenza activity in the state. So far, we have a total of 16 confirmed influenza cases, which is a very low level of activity for us. The majority of influenza seasons over the past years have peaked in February, and so we are not out of the woods yet. That does mean that it's not too late to get vaccinated against influenza. So just want folks to keep in mind that there are other respiratory pathogens out there, and that influenza does lead to severe illness, including hospitalization and death as well. So we want people to take precautions there. I will now turn it over to Secretary of Health, Kim Malcolm-Reisden.
Thank you, Dr. Clayton, for that update. Happy New Year, everybody. We are really glad to be in 2021 and working on vaccine distribution across the state of South Dakota. So I'd like to just give you an update on where we're at with that effort. Since our last call, over 29,800 South Dakotans have received the COVID-19 vaccine. That includes over 100 residents who have completed the full 2-dose vaccination process. So as you'll remember, for either the Pfizer vaccine or the Moderna vaccine, there is a second dose that people need to get. So far, we have seen 13,991 Pfizer vaccines provided and 15,888 Moderna vaccines provided. As Daniel mentioned, our state is doing very, very well. We remain at the top of all states when it comes to vaccine distribution. And I really credit that to several factors. So just briefly, the governor has been extremely flexible in allowing us to work with our partners to have a plan that works for South Dakota. And I think that's really been critical. We have been working in partnership with just some extraordinary healthcare partners in our state since August to have a plan to roll these vaccines out. We've also worked very hard at being transparent around what we know about the vaccine, what we know about our allocations, and what we know about the plan. As you all know, this has evolved over time, and it's really, been something that we've needed to stay on top of because many factors have changed over time. Definitely, we are all about preparing and not panicking, and so that preparation, I think, has helped us, as well as our experience in other mass vaccination campaigns, including the H1N1 experience several years ago. We continue to stress fiscal and personal responsibility, and so we're very pleased that people in South Dakota are wanting the vaccine and getting the vaccine when it's been made available to them. So we are very appreciative of that. Operation Warp Speed is, of course, the federal government's effort to get vaccines to states. And so just so you know, we will continue to get a weekly number of vaccines that will be allocated to us the following week. And so we expect to see about the same amount of vaccine throughout the month of January, but those numbers are actually confirmed on a weekly basis. And so we will continue to keep our website updated with that information as we get it. We rolled out a couple of informational tools this morning, so you all should have seen those. But just very briefly, we have a county-by-county map that is available on the website so that people across the state know which vaccination partner will be, vaccinating people in those particular counties. We have a couple of counties that have more than one vaccination partner because of population size and just the capacity to have more than one partner there. But otherwise, we've got every county covered, and really, again, I just really appreciate our partnerships with Avera Health, Mobridge Hospital, Monument Health, the Northern Plains Health Network, and Sanford Health. They have really stepped up and just been working extremely hard to get vaccines into arms. The other thing that we put out today is a graphic on what we expect to be able to, how we expect to be able to move through the different priority groups in phase 1. Now, I would just caution that this is tentative, and as we've seen, numbers can change based on what we get, allocated to the state. But at this point, we are vaccinating the 1C population and overlapping with the 1B population as well, which includes those long-term care residents. And we are hopeful and expect to be starting that 1D population in February. And you can expect that this chart will be updated again as we get more information. The other point I just want to quickly make is reiterate what Dr. Clayton said about testing. Testing remains very, very important to our response because, again, it's going to be a while before we get the whole population vaccinated. And so we need to make sure that if people have symptoms, if they've been exposed to somebody with COVID, that they are getting tested and isolating if they are in fact positive. If you're a close contact, we do need people to be quarantining so that we can, again, kind of slow that spread down. So please help us plug the fact that there are free at-home COVID tests available. They are non-intrusive. They're saliva-based tests. They're easy to use. And they're available through the covid.sd.gov website. So with that, we really appreciate your help in communicating this information to the public. We just appreciate that partnership with you. So with that, I'll turn it back over to Rebecca.
Okay. Thank you, Madam Secretary and Dr. Clayton. At this time, we would like to open the floor to all questions. If you could please identify yourself, your outlet, and ask your question. Who would like to go first?
Hey, this is Jonathan from the Argus Leader.
Go ahead, Jonathan.
With regard to the vaccination distribution, do you have estimates for the populations in say, like 1 Charlie, Echo, Delta? Do you have populations? And how will, if you're like in 1 Delta, how would I be notified? Say I'm a teacher. How would I be notified that hey, it's your turn to come get a vaccine?
Sure. So we'll pull up the numbers in the different groups, but let me answer your second question first, Jonathan. That is part of our planning efforts right now, and to a large degree, it will depend on how people will become notified will depend on the allocation that we get on a weekly basis. And so if we are in a situation where we are getting the type of allocation that we're getting right now, which is just shy of 11,000 vaccines per week, then the rollout to the 1D population will look different than if we are getting larger amounts. And so that is to say, if we're getting that smaller amount like we are right now, then we will start with notifying individuals that we know are in that particular group. If we get larger amounts, and that's what we're hoping for, then we will have more likely public-facing kind of opportunities for people to actively sign up to be vaccinated. Just to give you a sense of the numbers of estimates, and again, these are estimates that are based on South Dakota information as well as federal information, but the 1A group, which we've substantially covered, had a population estimate of 19,265 people. The 1B group, which we are currently vaccinating, includes those long-term care and assisted living residents, is 10,867 people. We are currently in the 1C group as well, and that has 49,642 people. When we get to the 1D population, that's the largest of our phase 1 priority groups. That's 265,561 people. And again, these are estimates. You know, they won't be 100% correct, but we know that the 1D group is very, very large. The 1E group then E as an elephant, has 448,000 people.
Okay. Can we have the next question, please?
Adam St. Paul, Dakota Broadcasting.
Go ahead, Adam.
Just wondering here, and I don't know if you've answered this before or not, I was off towards the end of the year, but when it comes to the vaccination process, if for any reason vaccines or a number of vaccines go to waste, whether due to, the storing procedure, and I think they have an expiration date and just don't get enough people vaccinated, so on and so forth, is the state keeping track of that, and do you guys have those numbers of how many vaccines aren't getting into people's arms?
I'll let Josh answer the technical aspect of this, but I just want to emphasize that one of our guiding principles with our vaccination partners is that we do not want to waste doses. And so that's why, in some situations you'll see, that's why we have kind of the overlap among the populations. And so, that's been something that the federal government has stressed and that we have definitely stressed and do not want to see that become an issue.
Yeah. And at this point, we have not had any reports of vaccine dose wastage, either due to vaccine inadvertently being outside of temperature ranges, vaccine that was not given once the vial was open, and so on. That is something that we work very closely and have weekly meetings with our vaccinator partners, and that's where those sorts of issues would arise. Now, you'll also note that some of the vaccine manufacturers, Pfizer, that we have seen out of a 5-dose vial that we've been able to achieve sometimes up to 6 or even 7 doses. And that has been really a blessing in terms of being able to extend the vaccine that we have received. Similarly, we have seen that out of a 10-dose vial of the Moderna vaccine, that on a fairly regular basis, I think that most providers are able to get an 11th dose out of that. And so the allocation, is based on the vial. So 5 doses per vial of Pfizer vaccine, 10 doses per vial of Moderna vaccine, and we're getting more doses out of those vials, and that was approved by FDA to do so as well, to help extend the doses that we had.
Next question, please.
Deb with the Black Hills Pioneer.
Go ahead, Deb.
So following up on that, how many doses does the state have that have not been given out so far then? Is it just subtracting the distributed from the vaccination line?
So probably the easiest way to do that would be, yes, to take what has been distributed, which is on our web. The link to the CDC's distribution is on our website, right. And then look at the number of doses that we have administered in the state. Knowing that there might come a time when the number of doses that we've administered, may exceed. I think there's always going to be this vaccine that's being received, and that still needs to be provided to individuals. But yeah, that would give you a rough estimate of the number of doses that are in play to be able to give to individuals in those priority populations.
I would just also...
Yeah. Go ahead.
I would just mention, Deb, as well, that remember that the numbers of doses that the state has received does not include doses that would be going to the Indian Health Service, the Veterans Administration, the National Guard, and other groups that are covered directly by the federal government. The other thing I would also note is that some nursing homes have as their vaccinating partner a federally contracted partner, and there's been a delay in the reporting of some of those numbers. So, we're obviously reporting everything that we have. There's just some caveats to the information on the website.
Okay, like Walgreens is maybe doing nursing homes in their area. Is that one of the federal partners?
Sure, that's
Yeah,
correct.
that's correct.
Okay, so what I've come up with is 15,719 that are still on the shelf, as Dr. Clayton would say. So what is your distribution percentage if we're leading the nation?
Oh, so that information is also...
Yeah, Deb will follow up. We're going to search for that here, super, and follow up before
Thank you.
on here.
Great,
Yeah.
thank you.
Next question, please. Can we please have the next question?
So, Ray from Caroline.
Go ahead, Ray.
Hi. You mentioned the encouragement for people to continue to get tested. Would that also include encouraging people who are asymptomatic at this point? I mean, is there more tests available, or would they be? Is that a group that should be getting tested? And then I have a follow-up to something else.
Sure. So again, the tests that we have available through that are free to end users are intended for people that have symptoms, as well as people that don't have symptoms but who have been exposed to people that have COVID, and so that could be a close contact or somebody living in the same household, or just folks that believe that they've been exposed. And so we really want people to not shy away from being tested if they feel that they have a need for that, whether they have symptoms or not.
Okay, so if I'm not a close contact, but I want to get tested for reassurance, would that be something that would be important in the days and months coming ahead, even if I'm not a close contact?
Again, for folks that have a reason to believe that they need to be tested, those tests are available. So yes, we would say, please go to the COVID website, order a test, and complete that.
Can I follow up on the vaccination dose numbers too?
Yes.
Okay, thank you. You mentioned just shy of 11,000 doses a week. Any expectation or any projection on when the number could change to where you could see, that double or any idea when that could change?
So Ray, again, this has the possibility of changing every single week, and so what we've got on the kind of with the graphic is based on what we know today, assuming we continue to get the same allocation that we've gotten so far and that we're expecting to get through the end of this month. But again, that can change week to week, and so we will look for updates to that schedule as our allocations change.
Is it more or less than you originally expected?
I think that's kind of a hard question to answer. At the numbers that we've been given have changed repeatedly, and so I don't know that we could really say what we were expecting at this point. I can tell you that, again, our vaccination partners have just done a phenomenal job of getting vaccines in arms, and that's what it's all about. And so we look forward to when that allocation increases, because we know we have many more people that want to become vaccinated.
Okay.
Thank you. Thanks for indulging me.
Can we have the next question, please?
JP from KORN News Radio.
Go ahead, JP.
Thank you very much. Could you give us a ballpark figure on how much a vial of the Pfizer and a vial of the Moderna vaccine costs?
JP, the vaccines are being provided to states from the federal government at no cost. And so those are administered to people without any cost to them as well.
Next question.
You're welcome.
Next question, please.
This is Jonathan with the Argus, if nobody else has another question.
1 second, Jonathan, just to check, is there anybody out there with another question? Hearing none, go ahead, Jonathan.
Oh, yeah, just with regard to vaccine rollout in South Dakota, do you have any insight, and maybe you don't, on how we're different from how other states are distributing their vaccines?
Yeah, so Jonathan, I don't know that I can speak specifically to other states, but I can tell you that some of the things that we've been doing, I think, have been very helpful to our vaccination rollout. First of all, we started planning back in August, and that's been very tactical and logistical planning. And so just kind of trying to foresee just some of the challenges that we knew vaccine would bring. The other thing is really, the governor's been very supportive of our efforts to make common sense decisions. And so we have, talked through a lot of different scenarios, and that's why I think you'll see the priority groups in our state, as in other states, they're meant to fit that state. And so she's been very supportive of us doing what we need to do to make it right in South Dakota here. We've also, again, enjoyed very good partnerships. We're talking, when we're able to put out a map of our state that has every county covered by one of 5, healthcare systems or providers, even when they don't have other services in those counties, I think that says a lot about them and about their willingness to step up and go outside of their, their normal business operations for the good of public health. And so we're extremely appreciative to those systems for really partnering with us in that regard. I think the transparency as well. I know, I think if you look at other states and what they've got on their dashboards and on their websites, we've really tried hard and tried to look ahead to what information is going to be important to people, because ultimately that information helps people make the right decisions for their health, and that's going to be very important as we work through our vaccination plan. And again, just that information does help empower those people, and that's ultimately what we think is going to be successful.
So I did want to provide the information that we have around the either way of looking at it as a rate or a percentage of South Dakota's population that has been vaccinated. So if you're looking at some of the different places that are tracking this, so if you go to the CDC's vaccine tracker, you can see that we rank number 1 in the nation for people that have received that vaccine. It's 3,231 per 100,000 population, and that's higher than any of the other surrounding states, as well as any other state in the nation. Our closest states in the surrounding states that are very high as well would be North Dakota and Montana for population. And then, there's also other trackers out there, but just doing a straight calculation of percentage of the population that has been vaccinated, and I use the 2019 census data as the denominator population. We have about 3.37% of South Dakota's population that has received a dose of vaccine, and in 101 persons in cases, they've received the full series of Pfizer vaccine.
Okay. I believe we have time for one more question. Can we please have the last question?
This is Kelly Hertz from the Yankton Press in Dakota.
Go ahead, Kelly.
Has anyone heard any rumblings or anything of whether the makers of the Oxford AstraZeneca vaccine might be making overtures or looking at coming into the U.S.?
I know that AstraZeneca, Johnson & Johnson, and several other vaccine manufacturers, are still in their trial phases or are, looking to apply for FDA emergency use authorization. I don't have specific information about, where any one manufacturer is in that process, but we do anticipate that there will be additional vaccine manufacturers that will gain FDA EUA approval and increase the vaccine doses that we have available to give in the United States and to South Dakotans.
Okay. We would like to thank you for participating in today's conference.